COVID-19 has dominated everyone who works in the medical field's lives for a year now. In a non-COVID year, the seasonal flu would typically be something that would be a major concern around this time of year. However, that has not been the case. I spoke with Dr. Justin Puckett of Complete Family Medicine in Kirksville about if all the safety protocols people are taking are contributing to the lack of flu cases.
Our social distancing, our mask wearing, the fact that we're not gathering in large groups, all those things together are having a positive impact on influenza to suppress down the number of cases that we're seeing here in the heartland.
For now, it seems the influenza virus has been tamed. However, once COVID-19 is under control, should we expect it to return with a vengeance?
I think our biggest issue is that we may see the flu vaccine not be quite as efficacious because we just don't have the data to base upon what should be in that flu vaccine.
Pre-pandemic people would still push through minor aches and pains, colds, and other things that made them not feel 100%. However, I asked Dr. Puckett if a positive that can come out of the pandemic is that people are now more aware when they should not put others at risk if they are not feeling well.
A positive from the COVID-19 pandemic that people can take towards if they get the flu is they're more in tune of telling their job or not to do anything if they don't feel well, I should say.
I hope that we'll be comfortable wearing, I don't want to wear a mask forever, all the time. But I hope that whenever if I get a cold and I need to run in the grocery store, I'm going to wear a mask in the future. And I hope that others in the heartland will feel comfortable doing that, because the hand washing, the social distancing, those sorts of things whenever we're ill have made a big impact on decreasing flu.
Finally, to put in perspective how small the number of flu cases have been this year, according to an article written by The Atlantic, 800,000 samples of the influenza virus have been reported to the Center for Disease Control and Prevention. Of those cases reported, only 1,500 came back positive. That comes to 0.2% of all the reported cases. That is drastically less than the 13 million people who have been affected by COVID-19 nationwide, according to The Atlantic. Reporting for KTVO News, I'm Matt Gunn.